Hey podcast listeners, a quick heads up about the RCR AI Conference 2026. Join the radiology and imaging community on the 29th and 30th of June in London for 2 days focused on how artificial intelligence is shaping the future of medical imaging and clinical practice. The conference brings together clinicians, radiographers, researchers and industry to explore real-world applications of AI, policy considerations and what's coming up next for the profession. And if you're an AXREM member, don't forget about those exclusive AXREM discounts.
Welcome to AXREM Insights, developing healthcare through medtech and innovation. Join Melanie Johnson and Sully Edgington as they talk with our industry leaders and experts.
Hello and welcome to the AXREM podcast, where we will explore the ideas of innovations and challenges shaping the future of diagnostic imaging, radiotherapy and healthcare technology. In this episode, we're diving into a topic that continues to spark debate, curiosity and, importantly, real opportunity across our sector: value-based procurement. I'm Sally Edgington, CEO of AXREM, and I'm here with Holly Ruddock from Sectra and Jack Bond from ISO, representing the AXREM Future Leaders Council. Today we have the pleasure to be speaking to Brian Mangan, CEO of Lock Consulting Group. So welcome, Brian, and thank you for being on our show today. Let's start by handing over to you to tell us a bit more about yourself. How has your career progressed and what drew you to the industry?
Thanks for that, Sally. Yeah, my career kind of started a long time ago. I think that's probably fair to say, back in the 1980s. I actually started working on the counter in the post office. We did that for about 8-9 years. Found myself in the stores, and then probably like most people, I found myself in procurement as well. When I was in Royal Mail, I used to buy wonderful things like rubber bands, and then decided enough of the rubber bands and maybe go and do something a bit different. So I joined the NHS back in 2004, and the first job I got was buying drills that take people's heads off, which was quite an interesting experience. Having like a real sort of fear of theatres and that. I managed to swear actually going in to see them actually in operation. And then worked at Wrightington, Wigan and Lee, did another few years there. So I had about 9 years in operational procurement. And I then got a regional job when I started with Northwest Procurement Development. And it was when I got the regional job, I kind of started looking at this thing called value, because basically what happened was that when I was a buyer, I was a horror. I had a really sort of like adversarial relationship with suppliers, and I did reasonably well. We managed to get a load of prices down. I kind of thought, well, we need to start doing something differently, and then started working with the University of Liverpool, come up with the term VBP, value-based procurement. And then I spent about 5 years going out, sort of, really sort of putting the message out about what VBP was about. 2019, I got made redundant. I decided to set my own business up, and having a great imagination, I decided to call the business Brian Mangan Associates. And then I went through a meeting abroad, and some fella said to me, "So who are you?" I said, "Brian Mangan." He said, "Where'd you work?" I said, "Brian Mangan Associates." And I thought, this doesn't sound right to me. So I kind of decided to come up with another name for the company, and it's actually Lock Consulting, and it's value in Irish. So that's very much kind of what I do, and I support both the NHS industry really to try and get an understanding about what the VBP, value-based procurement, value-based healthcare is all about. And that's me.
Perfect. Thanks, Brian. And from rubber bands to kind of life-saving equipment, what a complete contrast.
Yeah. There's a story to tell about the rubber bands, but we haven't got time. There you go.
Okay, well, we'll have to take that off podcast, and I'll look forward to hearing that at a later date. So last year, AXREM published our landmark paper written by Brian, Evaluating Value-Based Procurement, Principles, Practices and Impact, a piece of work that set out to demystify value-based procurement and examine how it can genuinely transform decision-making, partnerships and patient outcomes across the NHS and industry. Today, we're building on that foundation. We'll be unpacking what value-based procurement really means in practice beyond the buzzwords. How do we define value? Who decides it? What does good look like? And how can suppliers and the NHS work together to move from transactional procurement to approaches that reward innovation, long-term impact and whole system benefit? Whether you're a supplier, a clinician, or a procurement professional, or simply someone passionate about improving healthcare delivery, this conversation will help illuminate where we are now, what's working, and what still needs to change. Today, we're going to do things a little differently. Rather than questions and answers to and from our guests, we'll be having a panel discussion about value-based procurement. So I'm going to let Brian, as our value-based procurement expert, kind of start things off. And it'd be really good, Brian, just for you to give us, we're stripping away all the jargon and all the different acronyms and everything else, and give us an overview of what does value-based procurement actually mean in simple practical terms for the NHS, but also for industry and our members.
Yeah, I think for me, see, there is this kind of mystique, if you like, around value-based procurement, and I think it stems from, the word value. So what is value? It means different things to different people. And I think that's one of the challenges. So for me, it's something that's relatively straightforward. If you like, there's a couple of ways you can describe it. It's about holistic procurement. It's moving. It's not just looking at the price of a product. It's looking at the pathway itself. So it's looking at, what your products and what your solutions, what impact it has on a patient pathway, understanding what needs to change, by how much, and how industry can actually support to improve patient care, reduce costs, improve efficiency, and also make a positive impact on the environment. So it's not just looking at one-dimensional price. It's looking at the pathway and what the total cost of care will actually be. What's the impact of it? So for me, that's what it's all about. So it's just something that it's a lot of it's common sense. You can apply it to healthcare, you can apply it to non-clinical things as well. It's just to say, I think traditionally we've always just looked at the price. It's probably the simplest thing, and I think that's where we've been. But it's relatively straightforward today. But I would say that,
I think when you talk about, and that's really interesting, value means different things to different people. I think one of my concerns around value-based procurement is how can we get everybody talking about value-based procurement the same way?
Yeah.
And we see this across the health system in lots of different things that we're doing, where I could read something, a paragraph about value-based procurement, and Holly and Jack and you might all interpret it completely differently. So that's where I think, although it sounds simple, value means different things to different people, I think we can also interpret it in different ways.
I think I went to a meeting, conference the other month, and a clinician got on stage, and he was saying, "Well, for me, what is value?" And they said it's about impact. So I often use the term when I train people. I talk about delivering tangible and measurable benefits. So value has got to be something that you can touch and feel that makes a difference. So the example I regularly give, I had someone years ago coming in and they say, "I'm going to save you 2 minutes in theatres, and that'll save you £2 million." They go, "But 2 minutes in theatres won't save me £2 million, no matter how much you aggregate it up. If you come in and you save me half an hour in theatres, if I'm doing an orthopedic procedure, say a replacement knee, I can list an extra patient at the end of the day." So that's something that is tangible and measurable. But I kind of quite like the way that the clinician phrased it about impact. So I think for your members, it's looking at what is value. It's something that makes a difference, so that you can touch and feel that has an impact on the patients, on the health system itself, potentially on the environment as well.
I think as well, when it comes to impact, it's not just about the linear path you're seeing when you talk about, say, for example, your theatre example there. It's obviously saving the patient's time and you're getting the doctors and the nurses in and out. But there's also so many more staff involved in that process, which may not be thought about in the instance. And it's the trouble when you start talking about value-based procurement is when you say it's going to make an impact on the immediate people, actually what is the impact is going to make us the wider pathway to everyone else involved in it. And how then do you get all of those aligned to say, well, you would never immediately jump to the cleaners, for example, or the people who would be doing the turnaround time, but actually it may help them and give them more time. And what will they then do with that extra time you've now given them because you've streamlined the process for them? And what's the value to them? It's getting so many more people involved in the conversation and asking them, what is the value to you for something you may not even know is happening in the hospital or the environment at the time? And for me, that's one of the things I'm quite excited to explore, is to say it's not just the people involved in the process of the project, it's the people outside of it, and how does that impact them, and ultimately how does that route back to the patient.
Yeah, I completely agree, Jack. And I think, that's kind of at a certain point in time, but also value-based procurement, I think, has a really interesting mechanism by which it evaluates impact over time as well. So, what is the long-term cost saving? What are the long-term outcomes? And that's something you don't really get at the moment if you're just comparing price.
The way that I explain it, and it is something I've done it a number of times over the last sort of 5 or 6 years, where again you're just looking at the pathway. So you look at your current pathway, you get the right people involved, clinicians, operations people, finance, because you're trying to map out your clinical flows and the financial flows, and then you're seeing, okay, what is the, what are the problems? Say I mentioned it before. What are the challenges? What are the opportunities? What needs to change and by how much? And you can take that literally from someone, a patient's having a problem, through to them being discharged into the community. So I think it's something, to take Jack's point, that it is something that you can do, and then you can pick up. The other thing that I could talk about this stuff for hours, but I mean, it's looking at data points, measures. It's about 20% of 80% of the value within a pathway can probably be collected by 20% of the measures or the data that's required for it. So it goes back to what I was saying before about trying to keep it simple. So it's getting the right people involved, identifying what needs to change by how much, and then deciding what your baseline is, what your target is, and how you're going to measure it. So I think it's a good way to try and get. I did a conference last week with the HFMA, the Healthcare Finance Managers Association, and the Healthcare Suppliers Association. And I was saying to them, the VBP is a good way to bring people together, to break down the barriers between finance and procurement and clinicians as well. So that's
I
just.
think, yeah, and I think as well, like everything at the heart of what we do in AXREM is around the patient. So we want to make sure patients get the right diagnosis at the right time, and they're put on the right patient pathway. What I see as a bit of a barrier is this ring fencing of budgets. So on a patient pathway, that could be several different budgets across several different departments. So it's how I am a massive supporter of value-based procurement, just to say from the outset, and I know our members are. But it's how can we make that, the NHS is such a huge beast. How can we get all of the different departments doing the right thing by the patient at the right time, and not ring fencing their budgets and going for the cheapest product, which is what we see on a daily basis as industry.
I think that, sorry, I was going to say, I think that might come back to potentially my point, Sally, is say, well, you've got so many different people involved. You need to make sure everyone's aware of the cost, the savings that particular product is going to happen to their department, whether they think they're related or not. At the end of the day, there are so many different touch points a patient will go through a hospital. And if you then look at each department, each budget, what if you make a cost saving in one or a value saving in one, what is the cascading effect to everybody else? You need to start somewhere and need to evidence this is a viable pathway to show this is actually the not only the cost, but the time, the energy, the efficiency savings as you go through. It's getting all those people in the same room to say, look, this is what we're going to be doing from our pot of money. This is how it's going to help all of your budgets stretch further, because we're going to be giving your time, patients, or staff members back.
Yeah, and I think that's the difficulty with industry, is that we don't necessarily have access to that kind of data. So it really is for the NHS to define what those savings would be.
For me, I think I had this the other day actually, and again I brought it up last week. There's this sort of view that we work in silos, but if you think about it, a finance director is interested in the budget for the hospital or for the ICB. They're not in, it's not each individual business, each individual part of the hospital isn't its own profit center. So it doesn't make sense to it. I think I like what Jack was saying, and it kind of goes back to this thing about the pathway, but it's about getting the right people in the room. So what Holly was saying before about, sort of making sure again that everybody's quite clear about what's happening. And I'd say to people who have got a problem, to your members, is it's about getting, like I say, industry tend to have a real, very strong clinical sell, and the really kind of, or technical sell. So it might be, in Jack's case, it might be, actually it's from IT people or the technical sell, whatever it happens to be. But they tend to focus on that. Where for me, it's getting everyone in the room at the same time. First of all, you get the buy-in from the key stakeholder, that would be the clinician. But then it's bringing people in to say, this is what it looks like, this is the impact. So it's not beyond the realms of possibility. I think the term is journaling, but it's journaling the money from one budget to another. But that way, so it's not, it's just it's a perceived hurdle, but I believe it's one that can be overcome reasonably simply by having conversations.
And I think that is what is key here. And that's what I've communicated to the Department of Health and Social Care, who are working on value-based procurement, is that communication is going to be everything to change people's way of thinking. And, it is difficult, especially in an organisation like the NHS that is so big and there's so many people involved in procurement and finances and the patient pathway, is communication really is going to be key here, because we all agree that it's what's right for the patient. It's also what's right for the taxpayer, because long-term savings, it may cost a little bit more now, but in the long run, it's going to save an awful lot of money to the NHS and the taxpayer. That's what we should be doing. And we've been very short-sighted up until this point. And that Brian's really highlighted the value-based procurement piece over the last few years. And we need to, I think we've all got a responsibility to talk about value-based procurement, like we're starting to, hence why this is a great idea to do a podcast, so that people can listen and really understand from their perspective the value that it can bring to either their business, their at the NHS, their department, or whatever it might be. So I think from an AXREM perspective, I wonder, how does value-based procurement change the landscape for our members, both in how they innovate and how they demonstrate value beyond price? And I know, Brian, you've got some great case studies. I don't know if there's anything in our area that you can give an example briefly, or, really kind of delve into that for us.
I think there was one in the report that I did last year. But in fairness, I think with AXREM and AXREM members, I think the evidence has been quite light, and there's loads of stuff that people are doing out there. I think they're just not articulating it in a way, and they're not demonstrating. So if you look in other medical areas, there are case studies, quite a few, but particularly with your members. Now, whether that is, I kind of maybe go off at a tangent slightly. I'm wondering whether people think that value-based procurement is just theory, and it's not going to happen. I think that might be one of the reasons why. I think there's loads of things that are out there, but I think that people aren't just really articulating it. They're not sharing the stuff that they do. That would be my suggestion, is that people start looking at the solutions that they've got, and then sort of building up a picture that incorporates like a stakeholder map, so you can put down, okay, what does it mean to the clinician? What does it mean to operational effectiveness? What does it mean to finance? What does it mean to the environment? And then constructing these case studies or marketing material in a way that kind of touches a number of different points, that's demonstrating like value across the whole piece. So I think that's where I think just at the moment there's two things. One is that, are your members thinking, well, actually, it's not really going to happen? I think it definitely will. And then the other one is about, traditionally, it's been very much a clinical sell type of thing.
Yeah, I definitely think it's going to happen at some point. It's just looking into my crystal ball to say, when is it going to come through? That's the thing we're looking at the moment. Is we can put forward the values sort of for our own products and solutions, and say this is the potential implications for it. The reality is it's not really being adopted too much in the NHS openly at the moment. There's a lot of conversation. People say we're looking into it, And what I fear is it'll always be the eternal "we are looking into it" answer rather than "we're doing it this year." Unfortunately, the budgets are getting tighter, but the demand to deliver is increasing. If you want innovation, if you want things that are going to save you time and money and everything else along the way, unfortunately, some of those products and solutions are going to cost a little bit more, and you do need to look into the value-based thing. So I'm hoping it's going to happen at some point, Brian. I don't know when. I think the nice thing about the community we have at AXREM is that we can all share our own experiences and issues and actually come together as to say, look, this is the solution we can provide that incorporates so many different areas, and this is the best value we can possibly give. And it's something that we've never really understood before, because we don't sit around a table and say, we've got this site or this instance, we need to come up with the best solution that's going to help impact the patients as best as possible. How can we all come together to come up with the best solution? And I think that kind of collaborative piece hopefully will start going through in the future. But completely agree with what you're saying. At the moment, the evidence is light. I don't think it's for lack of trying. I think unfortunately it's for lack of adoption, which, fingers crossed, in the next couple of years, we'll have a very different conversation, and we'll have to do a 2-hour podcast and all the examples we've got we can put forward for you.
Yeah, and I think it really does in the end come down to knowledge sharing, people, applying this approach and then sharing their experience, but then also sharing the difficulties that they maybe encountered and then how they've applied it in their own experience. But I do very much feel that there is a shift kind of throughout the procurement space in general. I mean, with the new Procurement Act as well, like for increased transparency about how we're spending public funds. So I think, this change is happening. It's just a matter of time before it's applied across the board. And I think what we're doing with this podcast and, keep talking about it is definitely helping.
But for me, there's kind of three. I've done a couple of presentations recently on this about the very subject. Is this the time for change? There was one I did recently. It's 2026, the year the VBP sticks, and it is. I mean, I ran a session yesterday, and we had the 60-odd people there. We had one of your members there, and we had the Department of Health, NICE were there. We had a number of NHS organisations, both trust, and we had a representation of ICB and industry as well. And there's three kind of areas that I think to try and convince people that this is happening, and it's not just something that will happen, in the distant future. The first one is around policy. So you got your 10-year plan. So if you've had the joys of going through the 170 pages of the 10-year plan, I did a word search on it, and it mentioned value 77 times and outcome 99 times. Value is part and parcel. It's embedded into the 10-year plan. It talks about moving towards multi-year budgets. It should be, something that is music to your ears when it comes to your members, where they're actually beginning to recognise the fact that in order to deliver benefits, sometimes these things don't take 6 months, they might take longer. So there's multi-year budgets coming in. It refers to the pathways. So again, you might incur a cost in one area. So when I used to work at Wright and Wigan and Lee, I wouldn't really be bothered about what happened in the community, but it could be if there's a cost incurred in one area, but it reduces the cost in community, or the other way around. And I think what it's saying now is, again, it takes this notion of pathways and looking at budgets and really looking at how the money is used across the patient pathway. So you've got policy, and then Ollie mentioned about the Procurement Act, there's value in there. Then you've got perceptions. So I go out and talk to a lot of people. Procurement, they're beginning to get it. I was invited to the HFMA, which was the HFMA meeting last week, and that was a joint session of procurement and finance people, and they were really receptive to the presentation that I gave. Because if you look at it on a practical level, the example that I say is the savings well run and dry. So I've been banging away, a lot of people have, about chipping away at the price of products and screwing people down to the floor. Same in your area. When now we go out to tender, the potential is the prices are going to go up. So the opportunity to get standard, to get the traditional savings is really getting more and more, it's getting a lot smaller. The opportunities are getting fewer and fewer. So we have to do something different. And then there's this recognition of the total cost of care. So people are beginning to get it now. We've probably got 30, 30, 30, or a third, and a third. A third of people are really into it. A third of people are saying, yeah, this is happening. And you're always going to get some people who are quite reticent. But the other thing is then you've got about practice where you've got the Department of Health who are driving this now. So the work, the presentation they gave yesterday, the work they're doing, they've got 13 VBP pilots going on at the moment. They've got this new compass system that's coming in. So you've got the clout of the Department of Health as well. So I think you're probably talking about over the course of this year, you're going to start you're going to start seeing people's attitudes changing. And when we ran the session we ran yesterday, this is the third one. The first one we did was in October 24, and there's been massive progress. So I'd say to your members that if you're thinking about VBP, these things take time to embed into your organisation. I think you need to start realising that the writing's on the wall, it's going to happen, and are you prepared for it? So start looking at developing case studies and this kind of thing, because say it will happen.
And I concur. I mean, I'd be the biggest cynic. You know, we see lots of things coming from government around policy and things that are proposed, and we talk a lot about it, and then it doesn't happen. But I absolutely believe that value-based procurement will happen. I think that what I'm seeing from the Department of Health and Social Care is the ministers want it to happen. It's being driven from the top down, and and also now the bottom up as well, which is really good. So yeah, I have no doubt that it will actually happen, but I think that there's still an awful lot of work to do, and like I say before, in the communications piece. And I think it'll be interesting to see what you think around how procurement teams will genuinely shift from choosing the cheapest price in the current economic situation that we're in, with budgets being really tight. Members are saying to me it still always comes down to price, rather than looking at the bigger picture. So I just wonder, how we can get procurers shifting from looking at the cheapest to the long-term value, and what do we really need to change in reality to actually make it happen?
I think when I talk to the NHS, I say it's not about spending more money, it's about how you spending it. So you might have £1 million and it gives you 1,000 operations. I want to say that you spend the money in a different way, you might be able to do 1,200 operations. So it's looking at, you're not saying, the perception is that, there's going to be, you're spending more cash, but it's not about that. It's just spending it in a smarter way. So I think there's that. I think you've got the challenge with the fact that every procurer, where are we now? The 29th of January, procurers and NHS organisations up and down the country are trying to create their work plans for next year about where they're going to get the savings targets. And I'll tell you now, as I mentioned before, it's getting more and more difficult. I spoke to a colleague the other day. They look after 4 hospitals, and they've got 600 schemes to get their work plan, their savings for next year. So that kind of proves it that things are changing. So I think what you need to do is about looking at, going back to what I mentioned about what are the tangible benefits that you're actually delivering, and articulating that. So I think if you've got a scheme and you're looking at, you can prove that it's reducing the total cost of care, it's something that you should be taking to organisations. And then we're trying to get finance to recognise, again, in a more sophisticated way, the benefits that are being delivered as well.
Brian, can I ask you a question? I know you briefly mentioned about how industry can, create case studies and start working towards this adoption of value-based procurement. But is there anything else that, we can do as industry and as individual organisations to kind of support this transition within the NHS?
I think, to be honest with you, I think it's more about, it's trying to get the evidence that it works, which is why I'm probably not answering your question very well, but I think the more evidence that we can give them. So I wouldn't be sitting here talking to you now if I hadn't led the national project for NHS supply chain, and we had the case studies that are on there, and some of your members were involved in it, because everybody likes a story, and stories are a great way to explain how things are delivered in practice, aren't they? And I think that the more we do, the more evidence that we've got that it works, then people can see the wider benefits. And if it works in one area, it could work in other areas as well. So I think for me, that's what it's about. You're creating this momentum. And again, for your area, for AXREM, the number of case studies are, I think you've got opportunities to do stuff here. You know, when me and Sally were looking at the report and we were trying to put that together, we put a note out to the membership. I think we only got one or two coming back. So I think it goes down to, are people taking this seriously? You know, so that would be where I would say is it's about evidence. Create the evidence. It gives people confidence that it's working. They can see the benefits and that kind of thing. And people talk, don't they? They all talk to, they'll pick up the phone and say, this is happening in Liverpool. You know, this is worth doing, and that's how it works.
Yeah, and I think it's just putting it higher on people's priorities and up
Yeah.
their agenda. You
Yeah.
know what it's like. Everyone's really busy. It's kind of a firefighting scenario. I mean, especially this time of year where we're leading up to end of year budgets and there's
Yeah.
that crazy season of a couple of months. So I think it's how we need to think outside the box of how we can get it up on people's agendas, because I absolutely agree. Evidence is key to this. If we don't have the evidence, it works, it won't get adopted. And I think as well, when we were talking about kind of perceptions and how people see it now, it reminds me a little bit of AI. When I started AXREM 7 years ago, AI was like, I remember there was so much resistance, you know, it's never going to be used, it's never going to be upscaled. And look at the world we live in now, 7 years later, and the perception of AI has completely changed. And it's, clinicians accept it's not there to replace them, it's there to create efficiencies. And that's like value-based procurement. It's not there to create unnecessary burden. It's actually there to create long-term sustainable cost savings and better patient pathways, treatment, products, services for patients. So I think it's just, I see this moving in the same direction. And with AI, within the space of 2 years, everything changed dramatically. And I think because there is so much focus from the Department of Health and from ministers on this, I think we will see the same. I think this year is the year where value-based procurement, we will start seeing it being adopted. And then hopefully next year we'll start flying with this. And, it will be standard practice. And that's what we need it to be.
Just maybe play a little bit of devil's advocate, if I can. Obviously, we talked about efficiencies for the patients and efficiencies for the clinicians. And Brian, you mentioned about spending money smarter. And I think one of the obvious solutions I can think about is we need to educate and communicate back to procurement teams more to say this is the part of the solutions things you need to do. But Sally, you mentioned about efficiencies and getting everything done nice and quickly. In doing everything I've just mentioned in education, communications, and spending money smarter means you have to slow down to think about the money you're spending. Do you think there's going to be any pushback from procurement teams to say, actually, we need to get this done? We're going to carry on doing what we've been doing for the last many years because we've got targets our own to hit and we need to be as efficient as possible. So Brian, is going to ask you, what's the kind of response back when you've said spend money smarter? Do you get a good adoption, or do you get people coming back to say, we need to just get on and buy what we've been buying for the last 10 years?
Well, I quite timely to talk about AI. I concluded my presentation last week with adapt or AI, because to me, if procurement and finance don't change and become more strategic, then they can be. If you're just a transactional procurer and they carry on doing the stuff they're doing, you can probably get an AI system to do it. I think the VBP is something that is more sophisticated. So I think when you're looking at how procurement operates and how finance operates, if we're talking about the innovations with AI, then yeah, there might be certain roles within the jobs the procurement people do in finance which can be done through AI, but then that releases time to do stuff like this. You know what I mean? So, and I think if you go back again, probably sound a bit like a broken record, really, but the opportunities getting fewer and further between. Now, if you can go into someone with some of the technologies you've got the potential to save significant numbers. You know, you could be talking hundreds of thousands of pounds in terms of benefits across the patient pathway. But I think if your solutions are significant enough, people will do it because that's where the benefit is. We could give, you know, if you want to take it probably to the ultimate stage, if we give all the products away for nothing, we're still not going to save the NHS because the problems are still there. You know what I mean? And for me, it's you and your members have got loads of technologies. You're in a really innovative space. I think it's just about trying to get out there and have those conversations. If you know what the other phrase that I regularly use, if you ask a better question, you get a better answer. I think the conversations that we have tend to be quite, you know, transactional and one-dimensional. You know, you've got an MRI scanner. How much is it going to cost us? Type of thing. What not like you've got an MRI scanner. How can it help us improve our patient pathway? That kind of thing. I think it's having a different conversation, and industry equally not being wary of having those conversations. Because I tend to find what the training that I've done over the years with industry, I've always been dead surprised that people are quite reticent to talk to procurement. I think they see us as being a barrier, and you know, I mean, all right, I say I was a horror when I worked in procurement. You wouldn't want to come and see me. I'm a reformed character now, but you know what I mean. There's that perception about when you go in, but it isn't. It's about having a conversation with them and you know, explaining things in a slightly different way.
And I think it's also very tricky when something isn't mandated. So it's not something that they have to do. But what is really good is that it is mentioned in the Procurement Act. So, you know, it kind of has been, if you like, being brought into policy and legislation. But it is difficult when something isn't mandated. But I do believe we are, you know, sort of traveling in the right direction. I want this to be a positive spin because I think we've come a long way in the last year especially, and you know, some of the questions back to the Department of Health is I think a lot of people at the top really get value-based procurement and understand the value, but it's not necessarily filtering down. So they've assured me that there's lots of work being done in terms of educating people within that kind of supply chain and within the procurement process. And I think if they get that right, absolutely, you know, you guys as companies providing services, you too see the value. So I think if we can gather more evidence and more case studies to demonstrate that value, and that gets pushed up the chain, and you know, it's getting pushed down the chain from government and the Department of Health and all of Brian's fantastic work, then you know, the people in the middle we'll get to them eventually, and it's just, you know, it takes time. You know, and as I said before, the NHS is such a huge organisation. It's always going to take time to roll anything out because there's lots of different trusts doing lots of different things. Okay, so I think this has been a really great discussion today about value-based procurement. So I'm going to lighten the mood slightly now and go to the dreaded quirky question. So I'm going to go to Brian first. So Brian, if you could invent a national holiday, what would you celebrate and why?
Uh, you know what? That's just the worst question, isn't it? I've got a really, really boring one, and then a bit of an off the road. You could have a national NHS day, couldn't you? That'd be good. Let's celebrate the NHS. You could do that. And then the other one, you could have a give Brian a break day. I thought we should have a national holiday for Brian's. Brian, I've been haunted by the life of Brian film for years, and all Brian's up and down the country should have a break, and those are my two.
I think with the NHS one, wouldn't it be great if there was, I mean, obviously there can't be because there's patients in hospitals, but wouldn't it be great if there was an NHS day where everyone who works in the NHS gets an extra day off,
Yeah,
but they couldn't all be off at the same time. That's the problem. Um,
It's a
but
funny
yeah,
one, Brian. I had actually thought the exact same thing.
yeah,
And there actually is a national NHS day. It's not a
yeah.
national holiday, though, unfortunately. But yeah, July 5th. Um,
Yeah.
So yeah, my national
Perfect.
holiday would be probably something to do with ice cream if it's not national National NHS Day.
So we want a national ice cream holiday where we all have to have a Mr. Whippy. Other brands are obviously available.
Yes, and it'd have to be in the summer.
Absolutely. And Jack, what would be your national holiday if you could invent one?
I think mine's going to tie in quite nicely because my first head went to a national pub garden day where everyone can go to the pub, and there's one day where the pub gardens are all open, drinks are free, are cheaper or free, or you get an ice cream, and you can just relax and enjoy the sunshine. Has to be on a changeable day though, because obviously our weather's not that predictable. But that's just that's where my head first went.
I like that one. I like that one, Jack. I think I'll go with you.
I was just going to say, I vote Jack for PM.
Yeah.
For a national pub day. And also, wouldn't that be great in an industry that's really struggling with all of the economic situation to really promote it? I was just thinking as you guys were talking, and mine would be National Seaside Day because I love being by the sea. And again, I think it's really good for tourism, but I feel we should have a day there. We all take the day off and we all head to the coast. But I dread to think what the RAC and AA would say about the roads that day, because we'd have queues in and out of our coastline. But I'm a massive, I don't tend to go abroad, and I love the nature and the the tourism in our country. So I'm a huge supporter of staying in the UK and holidaying near some seaside. It's just you can't say it's going to be a sunny holiday because obviously we can't guarantee the weather here. But no, really great answers, and I really appreciate your taking part in today's podcast. So it's been great to have this conversation about value-based procurement. It is an important topic to talk about, and we hope you found it interesting. You can find out more about the value-based procurement paper authored by Brian on our website www.axrem.org.uk under the resources page. So a big thank you to our panel, to Holly, to Jack and Brian, and thank you for joining us, and thank you to all of the listeners.
If you have enjoyed today's podcast, don't forget to hit subscribe or feel free to share the podcast with friends.